Welcome to the Leadership Edge. Today we hear from Dr. Tom Marr. Tom is a former pediatric nephrologist. He was also the leader of a medical consulting group working with over 250 medical groups and hospitals. 15 years ago, Tom joined Health Partners, working as a director for clinical relations, serving in a role of liaison between the health plan and medical leadership in hospitals and clinics. He led the Health Partners from a volume-based care system to one based on value, a system that covers 1.3 million lives. He is also a professor at the University of Minnesota, working in the master's program, teaching graduate students in healthcare administration. Today, Dr. Marr talks about the triple aim and how it is an effective tool for today's healthcare environment.
Well, thank you for asking me to discuss with you the triple aim and the outcomes thereof. As we all know, the triple aim is the quality of care, the affordability of the care, and the patient's experience. Let's talk about each of those briefly, and that is quality. And quality is not just the process, but the outcome of the care. And we've had many attempts at measuring outcomes, but I think we're at the point now where we are truly measuring not just proxy measurements for outcomes, but the true outcomes. What's the functionality and quality of life of the patient from the therapy? Affordability is also very important. Even with the Affordable Care Act, the low-cost premium products have very high deductibles. My son-in-law called me one day and said, I can get a plan for $150 a month. And I said, what's the deductible? It was $6,000. So many patients, those who weren't able to afford care before and now believe that they are insured, are really betting that they will not get sick, they will not need it. But if they do, those first large amounts of dollars come out of pocket. So the experience of the patient is not only the amount of money they've paid, but can they afford it, and then what are they receiving for that? You know, the old quality aphorism of structure, process, and outcomes. Many of the times they're paying for the structure of the practice, sometimes for the process, but very rarely are they paying for the outcome. And whether you have a good outcome or not a good outcome, unfortunately, your bill is the same. So to add value, the question is, how do you improve the outcome for the dollars spent? I would suggest that the first one is to look at quality, and that there needs to be appropriate structure, appropriate processes, and we talked about the appropriate measurement of outcome. But what's the appropriate structure? Let's use dentistry for an example. Dentistry now is still a cottage industry. Almost all dentists are practicing in solo or small practices. They're not looking over each other's shoulders to see how they can improve. There's no peer review, and there's little oversight. I would suggest that that's a very difficult structure to produce quality outcomes. Whereas if you look at therapy partners, in which now you are an integrated group, that you have quality measures, that you're doing peer review and measuring outcomes, that the structure is there for good quality. Affordability then is, and photo is an excellent measure of that, of getting excellent outcomes at a lower cost without shrinking or shirking on the therapy provided. The second piece is the process, and that is when we look at outcomes and see wide variation, the question is what process variation is leading to that wide variation in outcome. And if there's wide variation, it reminds me of what an old professor of mine at Children's Memorial in Chicago used to say. He was one of the grandfathers of pediatric radiology. We'd have these big radiology sessions, and there'd be arguments about what the x-rays showed, and he'd say, you know, boys and girls, if there's more than one opinion, none of us know what we're talking about. So what is the appropriate process for the outcome desired? And yes, there's some art, but there also must be some evidence and scientific process to the quality of the care. Not just that they've completed 6 visits or they've completed 12 visits, but what's their functionality, what's the patient's functionality, and has it improved their quality of life? And of course, many factors go into that quality of life measurement. But have they gotten back to work? Have they gotten back to school? Have they gotten back to their normal activities because of the care that was provided? The other piece to that is, how effective has the therapist been in the relationship with the patient that has convinced the patient to do their own part in the rehabilitation? And that's a premise that I would just focus on for 1 second, and that is all of these issues are what I would call, they're all retail. that it has to be sold to the patient one-on-one, and that it requires a relationship between the patient and the therapist, that when that door closes, it's only the two of you in the room. And does the patient have enough trust and enough confidence in the therapy that's being given that they will carry out the required rehabilitation exercises afterwards? In this marketplace, where there is huge pressure on premiums and thus huge pressure on fee schedules, there can be an attitude of the more we do, the more we get paid. And I think that fee-for-service environment has generated that. But we're now moving to a total cost of care environment in which the primary care groups are responsible for the entire cost of care for that patient. Includes everything: lab, pharmacy, x-ray, therapies, physicians, surgeons, hospitals, etc. So now a primary care group is looking at what is the cost trend from year to year and what's being driven by that. Is it being driven by excess surgeries or surgeries that could have been averted by appropriate therapy? And I think the value of a physical therapist in a physical therapy group improves immeasurably because of this now pressure on the total cost of care rather than a volume. So if a patient's referred to physical therapy and the surgery is averted because the patient gets appropriate care and has confidence that they can handle this themselves after the therapy, you've saved that primary care group's total cost of care for a fusion, for an example, well over $65,000 to $85,000. That makes you a valuable partner. But you need to have a structure that supports that, and small groups just cannot afford the structure to support all of the things we're talking about. So Therapy Partners has a leg up in helping the members of Therapy Partners be successful in all of those realms. You know better than I what brings a patient to say, I would refer my friend to that physical therapist. It's not only the physical therapy part, it's not only the curing part, but it's also the caring part. And if a patient has confidence that the physical therapist actually cared for them, that they would be very likely to refer a patient back. How do we focus in the future on achieving these three aims? If you can show your value, that you provide excellent outcomes at an affordable cost and have quality measures, that gives you a leg up in this marketplace. And I think you're well positioned to do that. What's most important is that you come together as a care group, care delivery group. If it's only for business purposes, we've seen it over and over and over again, those collapse. Because you're not in the banking business, you're not in the finance business, you're in the care delivery business. And if you don't achieve better quality or better outcomes because of coming together, then the business aspects lose their allure over a period of time. The focus has been on money. I can tell you I've been in many board meetings of medical groups. And you walk out and say to yourself, are they a bank or are they a medical group? Because 75% of their time has been spent talking about finances and almost none of the time talking about their clinical outcomes. So I would suggest that balance of having a focus on how do we improve our quality as well as on the business aspects is crucial for a successful integrated group. The triple aim is the quality of care, the affordability of the care, and the patient's experience. The old quality aphorism of structure, process, and outcomes, many of the times they're paying for the structure of the practice, sometimes for the process, but very rarely are they paying for the outcome. So what is the appropriate process for the outcome desired? And yes, there's some art, but there also must be some evidence and scientific process to the quality of care. All of these issues, they're all retail, that it has to be sold to the patient one-on-one, and that it requires a relationship between the patient and the therapist. What's most important is that you come together as a care delivery group. If it's only for business purposes, those collapse.